saw your podcast with Mr. Undefeated. That was a strong chapter. But there you said you're also undefeated. And that's wrong, Pastor. But I heard you're a chain smoker, and I do pray you must defeat it. And that's not banter. So you won't face the real Mr. Undefeated, advanced lung cancer. I saw your podcast with Mr. Undefeated. That was a strong chapter. But there you said you're also undefeated. And that's wrong, Pastor. But I heard you're a chain smoker, and I do pray you must defeat it. And that's not banter. So you won't face the real Mr. Undefeated, advanced lung cancer.
The relationship between smoking and lung cancer is well established and extensively researched. Smoking is the leading cause of lung cancer, and the majority of lung cancer cases can be attributed to tobacco smoke. The harmful chemicals present in tobacco smoke can cause significant damage to the lungs over time, increasing the risk of developing lung cancer. Cigarette smoke contains more than 7,000 chemicals, including at least 70 known substances capable of causing cancer. When these chemicals are inhaled, they can cause genetic mutations in the cells of the lungs, leading to the uncontrolled growth of abnormal cells and the formation of tumors. Smoking cigarettes significantly increases the risk of developing lung cancer. According to the CDC, smokers are about 15 to 30 times more likely to develop lung cancer compared to non-smokers. The risk is directly related to the duration and amount of smoking. In addition to direct smoking, exposure to secondhand smoke, also known as passive smoking, is a significant risk factor for lung cancer. Non-smokers who regularly inhale secondhand smoke have an increased risk of developing lung cancer by about 20–30%. Quitting smoking at any age can significantly reduce the risk of developing lung cancer. The risk gradually decreases over time as the body repairs itself. Even long-term smokers who quit can experience health benefits and a reduction in lung cancer risk. While cigarette smoking is the primary cause of lung cancer, other forms of tobacco use, such as cigar smoking, pipe smoking, and smokeless tobacco, such as chewing tobacco, also increase the risk of developing lung cancer, although to a lesser extent. It's important to note that smoking not only increases the risk of lung cancer, but also contributes to various other types of cancer, including cancers of the mouth, throat, esophagus, pancreas, bladder, kidney, and cervix. Furthermore, smoking is associated with several other serious health conditions, such as chronic obstructive pulmonary disease, COPD, heart disease, stroke, and respiratory infections. Lung cancer is typically a cancer that grows quickly and spreads early. Survival majorly depends on early diagnosis and early treatment. However, only 16% of lung cancer cases are diagnosed at an early stage. Advanced lung cancer has a poor prognosis, as almost 5 out of 100 people with stage 4 lung cancer will survive their cancer for 5 years or more after they're diagnosed, hence the lines.
I saw your podcast with Mr. Undefeated. That was a strong chapter. But there you said you're also undefeated. And that's wrong, Pastor. But I heard you're a chain smoker, and I do pray you must defeat it. And that's not banter. So you won't face the real Mr. Undefeated, advanced lung cancer.
For more breakdowns like this, subscribe to Med with Cred. Then, of course, go watch the full battle between Black Lip Pastor and Dr. Cardio. The link to the battle is in the description below. Till next time on Medical Barz, The Breakdowns.